Wonderful. Yes, I'll do my best to be quick. I know lunch is next, but I've got a captive audience, and this is my favourite subject, so no promises. But what a fantastic morning it's been, and it's just so lovely to be back here with you all. I'm sure anyone that's seen me around have just noticed I'm permanently grinning. It's just been wonderful. So before I start, it's been 18 months since our last conference, and I'd like to start by remembering two of our friends who we've lost since we were last here. I know many of you will fondly remember Julian Thomas and Jackie Farrington. They were both regular conference and event attendees. Jules and Jackie served on our board of trustees and were close members of our community, and they'll be remembered for their sense of humour, warmth and kindness. And I know that their loss has been felt deeply by our team and many of you here today. So a huge thank you to you all. The progress that we've made over the past year would not have been possible without your support. Whether you've fundraised, donated, volunteered, offered encouragement, completed our evaluations and questionnaires, or supported our events, you've been at the heart of what we do. As many of you know, I'm here today not just as a charity leader, but as a BBS parent. Our family has been part of this community for 28 years, and like many of you, we've had our share of ups and downs of living with the syndrome, all of which have been made so much easier through being part of this community. And we've benefited hugely from the work of BBS UK, the clinics and advice service, the information resources, and of course these annual conferences. They've empowered us to become experts in our own condition, and they've supported us to navigate the day-to-day challenges of living with a rare disease. The overarching vision of BBS UK is that our experience, our knowledge and understanding of BBS will ensure that everyone who accesses our services is supported and informed about BBS and empowered to achieve the best possible outcome. 3 years ago, we developed a 3-year strategy based on our community audit. And that's informed our work throughout the period. And I'm so proud of how much we've achieved as a team and as a community during that time. In our last community audit, so in our latest one, we've done one fairly recently, 91% of respondents said that BBS UK is highly trusted, and members appreciated our leadership, our understanding of life with BBS. And 91% also said they felt comfortable reaching out to us for support, and 80% found our services helpful. 82% said that because of BBS UK, they have greater awareness of the support available to them, and 74% felt more confident managing the challenges of living with the syndrome. We're finalising our next 3-year strategy based on the results of that latest community audit, and we'll share that with you in the coming weeks. But for now, I'm going to take you through some of our work and the difference that we've been able to make, and that's thanks to your support. So we all know that the UK is going through an incredibly difficult time. Local authority budgets are being squeezed tighter than ever. Social care is stretched to breaking point, and support packages are disappearing. The benefit system, already complicated, is becoming harder to access and slower to respond. And as always, it's the most vulnerable that feel it first and feel it hardest. And for the Bardet-Biedl syndrome community, these pressures aren't abstract, they are lived realities. We saw this coming during the pandemic, and we created our advice service with the aim of supporting and empowering individuals and families affected by BBS by providing tailored practical guidance across areas including education, housing, welfare benefits, employment and social care. We support service users with navigating complex systems, advocating for their needs with local authorities to access the support that they're entitled to, with the aim of reducing isolation, building confidence and promoting greater independence. Ultimately, we want to ensure that individuals with BBS have the best possible chance to lead fulfilling lives within their communities. Currently, much of our work is reactive, responding to urgent, complex crises. In recent months, we've seen a rise in time-intensive cases as local authorities withdraw support packages and reduce their resources. A number of our young members have been unable to attend college due to the removal of accessible transport funding. And one of our older members who lives alone had their support package cut recently to just 6 hours of care a week, and these are not one-off cases. And what was once straightforward casework now involves prolonged negotiation and escalating need. Our specialist advice service is doing everything it can. We are that safety net, and we are that voice in someone's corner when they don't know where to turn. But the demand is rising and the complexity of the work is increasing. To meet this rising need, we are expanding the advice service and we're recruiting a new member to the team. And this growth is essential, not just to enable us to be there for families at the point of crisis, but earlier and proactively, so we can prevent these issues before they escalate. This growth has been possible thanks to a legacy gift that was left to us by Jackie Farrington, who sadly passed away last year. And we're incredibly grateful to Jackie and her family for this gift, which will have far-reaching benefits for our community. So moving on to our clinic service, I'm sure you'll all agree that it is the absolute gold standard in healthcare. BBS UK has its own contract with NHS England to provide support, advocacy and facilitation services, and we have a dedicated patient liaison officer attached to each service, and this connects us directly to every BBS patient, enabling us to offer our support and services from the point of diagnosis. Our team work extremely hard to ensure that every clinic space is filled and that patients are supported to attend and to make the most of that appointment. Patient numbers continue to rise, and we now have over 700 patients on our database. And during the last year, our team supported more than 400 patients to attend nearly 60 clinics and logged nearly 3,000 contacts in the process. Our close connection to the clinics also connects us with the experts in BBS. The clinicians and researchers whose support of our community and charity goes way beyond the clinic service. They serve on our scientific advisory board, they contribute to and review our information resources, and as you've seen today, they support our conferences, and we couldn't do what we do without them. Over the past couple of years, a key focus for our team has been to enhance the support given to our younger patients as they transition from children's to adult services. We want to support them to make the move with confidence and to engage in their healthcare as a young adult. So the service holds 2 targeted clinics each year for young people, and we invite them along the day before with a parent to come and look around the hospitals as a group, to meet some of the staff and to ask any questions they might have. And then while we're all together, we enjoy social opportunity, which might be bowling and a meal out, give them a chance to get to know each other and to make some social connections. And then, of course, we attend clinic together the next day. So the young people that took part said that it took their stress away and they felt less worried about their appointment, knowing and understanding in advance how the clinic would run. We also have a transition handbook, so it's a guide specifically for young people about living life with BBS, and we've got copies available on our reception out in the lobby. We also offer a range of excellent information booklets, and they're available in various formats, and they're accredited by the Patient Information Forum. Again, we've got a selection out in the lobby, so please take what you need. We've just completed a review of our medical information booklet, and that's packed with all the information about the different aspects of the syndrome. And that's aimed to support your interactions with the healthcare professionals and those involved in the support of you or your child. Each section has been rewritten and reviewed by members of our clinics team and is, of course, backed by evidence or research. So please make sure you recycle any old copies and take any new copies with you. And it can also be downloaded from our website. We're having that recorded in audio very soon. So in addition to these core service provisions, in recent years, we've also introduced other projects aimed at addressing key needs that have been identified within our community. Our most recent membership audit highlighted the mental health burden of living with BBS. Of those who responded, 76% had experienced anxiety, 61% had experienced stress, 49% had experienced loss of confidence, and 34% had experienced fear. And they were reporting that they'd experienced that within the last 3 months. And 39% said that low mood and depression had a moderate to severe impact on their life. And we did a separate audit for parent carers, and the figures for anxiety and stress were very similar. So recognising how difficult it can be for our patients to access counselling at the point of need, we've been working with Rare Minds to deliver a pilot counselling service funded by the National Lottery. It's been a small pilot project but has confirmed that the need is there, So we're now looking at how best to develop the service to suit the needs of our community, and we're exploring ongoing funding opportunities. Our IT Equipment Fund has been running for 3 years and aims to assist those with BBS to overcome digital barriers by providing access to technology. So we first support the family or the individual to seek what they need through other organisations or local authorities. But where this fails, we will provide a device within certain parameters. And this support enables access to education, healthcare, social care, and social connections, key factors in reducing isolation and promoting mental and physical well-being. And we've provided 22 computing devices to date. And the Chris Humphreys Memorial Fund was established by BBS UK to honour the legacy of Chris Humphreys, a founding member and conference organiser who was passionate about supporting families affected by BBS. And the fund has provided weekend accommodation for 20 families or individuals attending conference for the first time who would have otherwise been unable to attend. Details of all these services can be found on our website. So the charity has been committed to supporting research from the very beginning and is becoming an increasingly significant aspect of our work. Although we don't directly fund research, we do have a really important role to play in supporting the process and ensuring that patient voice is included from the beginning. And as we've heard this morning, we're starting to see treatments and therapies coming through, and that's a really hopeful and exciting time for our community. Over the past year, we've supported a NICE appraisal process, have been co-applicants or supporters of research funding applications, and we've supported with the development of research protocols and the development and dissemination of information resources. Through our membership of international groups, presence on external boards and attendance at international events, we have developed close links with other rare disease groups and BBS organisations around the world. And the connections made and the regular communication has hugely increased our awareness and understanding of the research landscape and the wider BBS community perspective. We know that there is strength in numbers, but with a rare condition like BBS, it's even more important. And to get the patient numbers that we need for research, we've got to work together. And an overarching aim of our collaboration with other BBS groups is to provide other countries with the support and information needed to self-organise, both to improve local well-being, but also to enable them ultimately to contribute data to improve disease knowledge and understanding and aid research, which ultimately benefits us all. But I'm sure, as you can imagine, as a relatively small charity, it can be a challenge to maintain the balance between providing the community support, I've lost it now, it's nearly lunchtime, bear with me, to provide the community support that is desperately needed now with the other aspects of our work and managing the governance requirements, the employer responsibilities, and so on. It's a big ask, but every aspect of what we do is based on the needs of our community, on what you tell us in person or via those community audits. And as mentioned earlier, we have conducted a second one, which many of you supported, so thank you. And that will be used to develop our next 3-year strategy. So we aim to have this finished within the next few weeks, and we'll share it with you as soon as we can. We've just been a bit distracted with organising a conference. That's all. We'll come back to it. So that's some of the work we've been doing, and I hope I've shown how desperately needed our services are. We are a team of 7 part-time staff, but all but 2 of us, and that's Nat and I. Everyone else is working in patient and family support roles across clinics and advice, and it's so important to us that every penny raised directly benefits our community. So what's next, and how can you help us to continue this vital work? So as we've heard, we were incredibly blessed to have received a legacy gift from Jackie, which the Board of Trustees, with approval from Jackie's family, have designated as advice service funding across 3 years. We're also incredibly grateful to have received a grant from BBC Children in Need towards core salary costs across 3 years. Spreading that funding across the 3 years enables us to gain maximum impact, and that's really important. But of course, that still leaves a fundraising gap to be filled with community fundraising, corporate giving, regular giving, and so on. So our hope is that with your support, we can take this opportunity to build on that legacy and grow our community fundraising and other income streams so that we're not overly reliant on one kind of income source. And this will be essential to enable us to sustain our services beyond the next 2 to 3 years. And you never know, we might even have some fun in the process. So I thought it might be useful to share some of our targets with you all so you can see the scale of the challenge. So our target for fundraising events and campaigns this year is 20,000. Last year, between you all, you raised an amazing 17,500, and that was through sponsored horse riding, playing golf, running marathons, afternoon teas, selling knitted toys, birthdays and anniversary fundraisers. You did it all, and we can't wait to see what this next year brings. And rumour has it that someone may be jumping out of a plane for us at some point. That's above and beyond, if you ask me. If you would like to support BBS UK by creating your own fundraiser, come and speak with us and we will do all we can to help you. It can be really easy. You don't have to do a marathon, you don't have to do a skydive. We have a few fundraisers who hold events year in, year out and providing a reliable income stream, and that is gold dust for charities. So we've had Michael O'Sullivan running in the London Marathon for us tomorrow, and he'd been working extremely hard, training. Unfortunately, he succumbed to an injury, so he's had to pull out for this year, but his place has been held over for next year, so he'll be carrying that forward. We have, I think the ballot is open now from yesterday for 1 week, so if any of you are feeling the urge to run a marathon, it sounds like great fun. Then maybe not you, Gary, but then you need to put your name in that ballot box. So go onto the website, and if you get lucky and you run for BBS UK, we will refund your entry fee. And we also have 4 places up for grabs in the Vitality 10K, so that's a bit more achievable, and I think that's in September. So again, if that sounds like your bag, come and speak to us. So another area for growth is our Friends of BBS UK scheme. So we don't charge membership fees, and this is a way that we can ensure a reliable and stable income stream that we can rely on. It doesn't need to be much, just a few pounds each month can add up to a significant amount. And we currently have 57 friends making monthly donations from £5 upwards per month, and we have an ambitious target. We'd like to gain 20 new friends this year. To launch the challenge, we're offering a free BBS UK goodie bag to all new friend sign-ups this weekend. And if you're watching at home, you can still join in. Just drop us a line and we'll get you signed up, and a free gift will be on its way to you. Individual giving or one-off donations brought in 5,000 last year. So our target this year, let's try and raise 6,000. Every pound counts, and it makes a huge difference when it's added together. Corporate giving is another easy win. Many employers offer matched funding programmes, sponsorship opportunities, or they'll have a charity of the year. And they will always favour charities where the member of staff is connected or is close to the organisation. So have a think. You might know someone or a company that can help. And we're always incredibly moved to receive in memoriam donations, and our love and deepest thanks goes to everyone who has supported BBS UK or any other charity close to their hearts at such a difficult time in their lives. And of course, we've heard about the significant difference that leaving a gift in a will can make, and we're always so humbled when remembered and supported in this way. So I hope you can see the difference that we can all make by working together. Every donation, every fundraiser, a new connection we make strengthens our ability to plan for the future and protect the safety net for the people who rely on it most. So just to finish off, the work of BBS UK is broad, it's impactful, and it's deeply rooted in the needs of our community. Every part of what we do is about helping people with BBS live better, more connected lives, but none of this happens without you. We know that we are stronger when we work together as families, individuals, professionals and supporters. We're stronger when we fundraise together, when we advocate together and share experiences that build understanding and drive change. We're stronger when we're not afraid to ask for help or to offer it. So, if you would, I'd like you to think about how you might be able to help. Can you join our Friends scheme with a small monthly gift? Could you organise a fundraiser? Or perhaps you know someone who'd like to fundraise for us. Connect us with a charity, a company that might support our work, or simply spread the word and help us grow our reach. Every action, no matter how small, helps us to help our community. That's it from me. Thank you.